Okay. I really like the last one. I mean, with all the words up there. So our next session is not far away of what we have previously. It's about IT skills and competencies. So we'll continue in the same framework. Vicente, who's supposed to be here, had a late flight. Flight was a little bit delayed, so he will be with us, but after that session. And Rachelle will be virtual with us, hearing her on a video, because now she's at California. Her daughter it's her daughter wedding today, so. So we'll start, and Rachelle, through the video, will continue. And I would try to explain you some tools that are out there that we can use about competency interoperability, mainly for IT skills for healthcare workforce. But also we're going to look at a career map tool from AHIMA. AHIMA is the Association of Health Informaticians in United States. Briefly, I'm going to tell you a few things about the Global Health Workforce Council, an effort towards the promotion of competencies, IT skills in healthcare workforce. Briefly, I would guide you through the e-competence framework, where you can also go and see how it is being formed. And last but not least, Rachelle will present us the HITCOM tool, which is the output of collaboration between the United States and the European Union. So first, in the CAMEI project, we propose a framework for a social and semantic registry of IT skills for healthcare workforce. But first of all, a few words about CAMEI. CAMEI is a coordination action in the scientific area of medical education informatics for fostering IT skills for healthcare workforce in the European Union and the United States. It's a 2 years project. It is being coordinated by Northern Research Institute. The other partners are Aristotle University of Thessaloniki, Karolinska Institute, and the Polytechnic University of Valencia. It will end sometime in October this year. And it is run for 2 years and try to coordinate the activities between European Union and United States. The project is the European output of this agreement, let's say, this memorandum of understanding. They had a call in order to find some people to coordinate these activities for the healthcare workforce IT skills. In parallel, there is a collaboration workforce development work group that had weekly meetings and tried to do a lot of work during the last 2 years. It ended its activity on May, establishing quite a lot of things if we consider the short term. Some of the steps that this workforce development work group taken was to outline the scope, the statements, and the goal objectives at the beginning, then to identify a setting where they can identify competencies, and then identify the acute care setting. It is followed by defining roles in the acute care setting, and then they categorize the skills from existing competencies silos. And at the end, they map the skills to the professional, the roles. After selecting as a case the acute care setting, the roles were defined and they placed in 40 different buckets. Then, then 10 different silos of competencies from all over the world were analyzed, and they categorized them in 40 buckets, and they mapped the competencies with its role. So the proposal of CAMEI of how this could be enhanced and actually be a live thing and updated all the time was this framework. But why now? Because users are becoming more and more literal with social media. So the social aspect of this framework would be known to the users. On the other side, World Wide Web has been changing towards clean data and semantified information to lead to the web of data. So the semantic element is there, the technology is there, we can use it. And existing qualification frameworks and guidelines for IT skills for healthcare workforce was limited. So going directly to the framework, we could, with this, the aim of this framework is that the users, which is the healthcare workforce, the institutions, and the policy makers could collaboratively shape the required IT skills and competencies for each healthcare profession. At the same time, all the knowledge created at the registry could be shared through the semantic web and linked with existing silos of knowledge. So we have three components in that framework. We have the social network component, the skills input analysis and presentation concept, and the semantic concept. The social network concept is that everybody can see what competencies a colleague or a policymaker upload, can comment on it, can agree, can disagree with it. An ontology, of course, is needed for all that, and some initial information. The initial information is there through the acute care scenario of the workforce development group, and the ontology can be based on the way they are describing the information. So when we enter the skills into this framework, we can have an analysis of skills and the presentation of the results. We enter a list of the healthcare work profession is depicted. Each profession has a list of IT skills required for it, and it is divided in 3 levels: on basic, intermediate, and advanced. This distinction between the skill will makes the whole framework more adjustable. When somebody enters a new skill, then somehow we have to see if the skill that the IT skill that I believe that this specific role should have exists. If it exists and matches in a really high percentage, then we can just keep the skill until somebody says that No, this is not. If it has a close match, then a review should take place. But if the match is a little bit bigger, the priority for review can be lower. And of course, the depiction of the results should be there, and somehow we should divide the presentation of the results both at basic, intermediate, and advanced skills, but also on the most common skills that we can see, some that are not so common and rare. So this is an idea that can be fit with the whole concept of the European and the United States collaboration in IT skills. And of course, there is a semantic concept which is comprised of an ontology that describes the IT skills and their connections with the different healthcare professions in order to provide a coherent structure of IT skills for healthcare workforce depiction, a SPARQL endpoint in order to make available all the registry information to all the interest parties, links and linked open data cloud datasets in order to enable connectivity with information that exists in the registry. Of course, there are some limitations, there are some needs, further needs, and more elaboration on the idea. This is a competence map that was developed from AHIMA, as I earlier said, the Association of Health Informaticians in States. It's an interactive and visual representation of the job titles and roles that make up the scope of this health informatics map and the career pathways associated with them. There is a relationship with Council for Adult and Experiential Learning. It is broken down in 6 job families, 4 skill levels. It describes 50 current job titles in the States and 13 emerging job titles. There is a small link here that So, for example, if we are working as a data analyst and we're a clinician informatics coordinator, in order to be promoted to a director of clinical informatics or become an informatic researcher, there are some steps that we have to follow. And here you can see the job responsibilities, the skills that we require. We can also find this job. So it's a quite useful tool for people that want to see how they can be promoted. And this is in the area of health informaticians. Okay. A few words about the global health workforce development. The use of health information technology products and services is growing globally. And as countries innovate their healthcare system to improve care and outcomes and reduce costs, all healthcare systems, regardless of how well financed or organized, need sufficient numbers of well-trained and highly skilled workers to implement and manage long term their health information technology system. To address this need, the US Department of Commerce is supporting AHIMA and its partners, the International Federation of Health Information Management Association, is an initiative to establish a global health information curriculum and competency standards that provides a framework for healthcare and educational systems worldwide to update and rebuild a workforce strategy. The first steps to advance health information education workforce training standards is establishing a global workforce council. The Global Health Workforce Council, as I said, is sponsored by AHIMA. It's a foundation and include 14 members from all regions of the globe. And the goal, as I said, is to establish a global health information curriculum and competency standards. The European Competence Framework tool. I think it's on the 3rd version now. And they have a really nice interactive site. It's okay, this is it. It's not dedicated to e-health, but to electronic competencies in general. Some efforts and discussion are taking place in order to adjust and create a similar framework for the healthcare workforce. You have different profiles. So if you are a digital media specialist, you can see the competencies that you have to have and in which level. You can select your own competencies in order to create your own profile. And then you can even compare it with another job profile. So you can just go through it and see what are the its role, competencies, proficiency levels, knowledge examples, skills examples, etc. And of course, you can print it, export the output. And as I said earlier, the European Union, the United States Workforce Development Working Group developed this HITCOM tool. There is a link at the site. If I manage to go there, you can see both the addresses of the, I hope it's here, program. Both the addresses and the way that this tool can be used, but also we're going to hear Rachel now. Okay. So there is some sort use case scenarios that you can go through. But before that, I'll try to make a video play.
Meeting etiquette. So today,
This video is for the from the last meeting, and actually it was a goodbye meeting for the EU-US Workforce Development Group. You can actually find it online as all the previous meetings, both the presentations and the videos.
On this call, who wants to look at this work and consume this work can do so by simply accessing.
So I will leave it in Rachel, and I think we need a few seconds to go to the exact point.
So Rachelle, are you able to speak?
I hope you can hear me. I'm able to speak.
I can hear you. Yep.
Okay, great. Thanks so much, Jamie. And yes, we're fantastically proud of all the work that's gone into the HitComp tool. I'm sure many of you, most of you, definitely the community has heard of the tool, has hopefully seen the tool and used it. And if you haven't, we will give you an opportunity to do that. It's interesting, I'll just say quickly, how we progressed from Athens to Boston and then finally to Riga last week. In Athens a year ago, we did not have a tool. I don't even think it was an idea. We just had those spreadsheets and a lot of information, not digestible. By the time we got to Boston 6 months later, we had the bare bones of a tool, but still needed a lot of work. And we got to Riga, and we had pretty much the finalized version of the tool, still always going to be needing a little bit of tweaking and upkeep, but I think it's something that this community can be very proud of. So the HitComp tool stands for the Health Information Technology Competencies Tool. It's an interactive tool. It's not just a tool, it's both a tool and a repository. It's interactive. You can use this tool to filter and research competencies, and these 1,000 competencies that Jamie spoke to earlier, in two different fashions. One fashion, just searching through the competencies, and then you can also search through those roles, and they're interrelated. So we're putting this out there to be used by employers, educators, managers, recruiters, and others that you see there in both the public and the private sectors. And I think that one of the greatest benefits will be to those actual workers, both those incoming and those future workers and current workers who want to see where they are, be able to see if they have the right tool set, and then if not, to see where those gaps might be and how they can go forward to close those gaps. So again, you'll see on your screen there, that is the web address, and anyone can go there. It's open source, as Jamie has said. And what we'll do right now is we'll do a really quick demo. Probably not go through all scenarios, but I wanted to show you. We wanted to show to the group the abilities to use this. So Jamie, if you could just go to the tool, and I will go through the different types of scenarios we can do. I'll show you both sides of the tool. Like I said, there's competencies that we can look through, and there are roles. So, Jamie, can you pull up the tool?
Can you all see the tool?
Hope everyone can see it. I can see it, Jamie.
Thanks, Rachelle. And I'll just do what you tell me to do.
Great. So this is our tool. We have a home page. We're still doing a little bit of crafting on it, but This will basically be where you can find an introduction, how to use the tool, as well as a glossary of terms. We're going to be building a little bit more on this, making sure that it's quite robust as we go forward. But that's basically the home launching page. Then it's organized into 2 tabs, as you can see. One, which Jamie has clicked on, is the Competencies tab, and the second will be the Roles tab, which we'll go into a little bit more when we go through this use case scenario to show you how it works. So basically, you would start on the Competencies page. Typically, you don't have to start there, but this is a great place to start if you really want to just do a search of different competencies that are applicable by these areas, which we call filters. So as Jamie's shown, we have domain, the 5 domains that she spoke about. They're in alphabetical order there, so you can see we did start with direct patient care, and as a clinician, that was something that was really unique, I think, about our work and about this tool, is that there are a lot of competencies available, but it's really hard to find that mapping for the direct patient care. What skills do those care providers need in terms of HIT? So we've attempted to do that with our work here. So for example, our first case is we have a hiring manager. Her name is Maria. She has several new nursing positions. They're open, and she needs candidates to have e-health or HIT skills. So how can she utilize this tool to see which competencies would be needed? And she's looking at nurses from an intermediate to an advanced level, and in order to be able to achieve the organizational goals, they need to have a technology background. So she wants to write job descriptions. She also wants to place ads for nurses, and she wants to see which competencies are applicable. So what we're going to do first, because nursing is in direct patient care, we'll go ahead and click our direct patient care filter under the domain. We'll also then go to our levels. So we know that she's really concentrating on those in the intermediate and advanced level. We do have other roles in all of those levels, and of course baseline. Just if you could click real quickly there, Jamie, again on the level. I just wanted to point out that baseline level applies to everyone. So when we see baseline, those are the competencies that the group adopted, the community adopted, in terms of everyone would build on those, no matter what their level. Okay, thanks. Now, the third thing we're going to do is that we see is there's a competency filter, but we won't select that because, the category which we have, but she wants to see all of the categories. Yeah, if you could just pull that down. We have about 30 competency categories where we can filter into each of these areas, which makes it great. But we'll do that in another case. And right now, we just want to look at what's shown. So as you can see, this is a kind of a cool thing that we've just recently been able to add. We now can see that there are 1,008 competencies in total, and from our filtering, what we've found are 128 that are applicable to our search. So looking through that, we can look at, and we will start to see the results right below here where the stat is. We can also export those, and I'll show you that just a bit later. But what you can do, as Jamie's showing, is you can collect, if, for example, this one that she's looking at, compare and contrast, they already have those skills, or that's not something we're really looking at. What you can do is you can collapse those by clicking on the little eye, as Jamie is showing. Collapse those that are not applicable to you. That also narrows down your data list in terms of the number, and just get those that are applicable to yourself. And what you can do is you can export that data, and we can either do that as a comma separated values list, XML sheet, and this goes directly to your Excel spreadsheets or any other type of spreadsheet functionality you have, and creates a great list that you can take, save, use, and use it for further use, research, for your own use. So it's great. You can use this offline. So that's basically shows you how you can do a most basic search. It shows you all those intermediate and advanced level results. You can sort those by clicking on each of the categories as well. One thing you can do with this, and I'll just do this quickly so we can go on to other things, but I wanted to show you, if you looked at, Jamie, if you can click one of the levels there, if you could just click level for intermediate. Yeah, level and just click intermediate. Yeah, that'd be great. And what you'll also notice under level, we have a little box that's next to the intermediate. It's a little box with an arrow in it. And what you can do with this is you can actually apply this level to roles. So in other words, if you wanted to see which roles were applicable to the intermediate level or intermediate skills, you can do that. So if you could just quickly click that, Jamie, click that apply to roles. And what that does is it takes us then to our roles tab. And then we see, these are all of the intermediate roles that are associated with our competencies. Further, what you can do with this once you're on the role sheet is you can actually go and say, well, you know, I'm only interested in nurses. So for example, if we wanted to go up, back up just a tad, we can look at our domain. We know our nurses are in. If we can select direct patient care, that'd be great. We can then sort for, and then we'll see all the roles that are applicable to intermediate within direct patient care as that comes up. So it's great. It has a list of all the roles. Again, like Jamie had said before, we have the descriptions of all those roles and a new feature which we won't be able to show you today, but we do have actually what those roles are listed here, and those roles we have in 5 major U.S. and European languages, including English, French, Spanish, German, and Italian. So this is pretty cool. The other thing is that you can sort that by level. You can sort it by service categories. If you just want to see the nurses or you just wanted to see the professional types, you can do that as well. So hopefully you can see it's a pretty useful tool. We have some other case studies, but I think in essence of time, because it's half after, we won't go through those, but we'd be glad to, to answer any questions. You can email any of us, and if you have further questions about how to use the tool or some things you can do with it, we'd be happy to help you out further.
Thanks, Rachelle.
Sure, Jamie.
I was going to just go back to our presentation then. I did want to make sure to reiterate just a few things to this group as we get started, or as we looked at that. This is open source. This will be made available on our wiki page through the link that we've shown on this slide deck. Anybody and everybody is welcome to use this and use it for whatever purposes you think will work best for you. If you're an educator trying to develop curriculum, if you are already in the field and you're trying to get your staff trained, if you are trying to write job descriptions, if you are trying to do lots of different kinds of activities along sort of educating that incoming workforce, we know that has been historically a challenge, is getting the right people in health IT jobs. This is, we hope, a tool that can help move us in the direction of creating a competent workforce. And certainly the other really huge point that I want to emphasize here is that this wasn't work done by just the US or just the EU, but work that both the EU and the US agreed upon and said, from a standard perspective of what kind of e-health or health IT competencies do we need, this is what we came up with. So when you're looking at this, this has got more global implications than just something that would be regional or local to you. So I just wanted to sort of emphasize that with this tool. I want to just make sure that we have time because we have some real world, excuse me while I get through our slides very quickly here.
So that was the presentation of the HitCon tool. So I think that we have 10 more minutes, or can somebody check the program because I left it somewhere down. What time the session ends? In 10 minutes? Or? Oh, actually, we have to finish it now. So those are some tools that we can use in order to define competencies and IT skills for healthcare workforce. If you are a clinical person, you might need that to define a new person that you have to hire in your area, or you have to identify what the skills and competencies you need to take in order to be upgraded in your job. And if you design courses, you can use such tools to create a curriculum and connect the educational material with the competencies and the skills themselves. So I would like to thank you for your patience, and